So when we hear conversion therapy, obviously we're like, no, that is so wrong. Primarily because of the way that that was used to, like, I guess, continue the oppression of, gay people or lesbian people or people that didn't fit into like this perfect sexual mold that we said was acceptable in Western culture. Obviously it's wrong and it doesn't work. It's been proven time and time again. Like, if you're gay, you're gay. Like, you're not going to go to therapy and get rid of that. What is the difference between conversion therapy and just regular explorative therapy as far as like diagnosing someone? Because there is a protocol when you're diagnosing someone. So if I have bipolar and I come in, there's steps to figure out if I am or if I'm not, or if I have body dysmorphia or whatever it might be. So I guess to the lay person, what's the difference between conversion therapy and then just trying to do a general assessment of somebody?
Well, look, conversion, I'm going to call them practices. I'm not going to necessarily use the word therapy, but they do exist. They have existed. They are abhorrent. They don't work anyway. People often think of horrific things that have gone on, such as, corrective rape and electric shock therapy. These things are awful and have happened, and it's shameful that those ever happened. Those practices are already illegal. They're already caught by legislation. The purpose of these conversion therapy bans is in effect to kind of clamp down on talking therapies, the type that a therapist or a counsellor might engage in. But, conversion therapy, unfortunately, is now being used as a synonym for explorative therapy, because what those on the other side are saying is that you must affirm. That's the word that they like to use. And the therapist's job is never to simply affirm what a client is saying. People come to therapists for all manner of mental health conditions, and it's a therapist's ethical duty to explore, to question, even sometimes to challenge, in order to figure out what is in the best interests of the client that they're sat in front of. It's not to simply kind of nod along with whatever the client says to you. You mentioned bipolar. Equally, some people have forms of condition where they've, delusional, grandiose thinking. They convince themselves of things that aren't real. A therapist would be breaching their ethical duties if they simply just went along with that thinking. So this is the concern that we've got, that it's going to just criminalize normal therapy that we would do for any other condition.
Yeah, and I believe that's already underway in Canada, where it has to be just simply affirmative care. Are there any repercussions? So I'm scheduling this detransitioner for the podcast. I'm just working with her schedule right now, and she underwent like hormonal therapy and actual surgical manipulation while she was still a minor. And then when she turned 18, she was like, "Whoa, what did I just do?" But there's nothing you can do like that. It's irreversible. So are there steps that you can take? Like, is there litigation that can happen because you were a minor? Because I definitely want to get into consent with you as well, and the idea of that. Like, what are the steps for somebody in that situation?
Well, it depends on the jurisdiction, but we are seeing an increase in potential litigation in this space. There's rumblings that there's going to be some group litigation in the United Kingdom against the Tavistock Centre, which is kind of the clinic under the National Health Service that has been facilitating medical transition for young people. There's talk that there will be a group litigation suit brought against them, and we're waiting to hear the details of that. So there may well be legal routes, but as you've just said yourself, the procedures themselves are irreversible. And this is the issue, because we're almost forcing children into making decisions that could end up affecting the rest of their lives. These are decisions that I would argue that as adults we should not be allowing them to make in the first place.